When choosing a caregiver agency, it's important to ask the right questions. In this video, I'm sharing 15 things to ask your caregiver agency before you hire them. I'm Mitch. I'm a physical therapist and patient care coordinator with Premier Companion Care Services. I'm here to answer your home care questions. Making the right choice for elder care is never easy, but we're here to help. Check out the rest of our videos on the channel for great information. Question 1. What services does the agency provide? Do they have medical or non-medical services, or both? Is there any kind of specialized services, such as dementia or Parkinson's-focused services? Understanding the services the agency can provide you and can't provide you is absolutely critical when considering the needs of your family and making the right choice. Question number 2. Is the agency properly licensed and insured? Does the agency have all the proper federal and state licensing? You'd be surprised, but sometimes they don't, and that's critical to ask. And you absolutely need to make sure that the agency is insured. Again, if the agency doesn't have proper liability coverage for their caregivers, then you could be liable for any kind of accident that happens in the home. Question number 3. How qualified are your caregivers? This is a very important question to ask. You need to make sure that the caregivers are receiving proper training and are properly accredited to do this job. If you have somebody with no experience at all, would you want them taking care of your loved one? Absolutely not. Question number 4. But how are the caregivers screened and hired? What does the screening process look like for the agency? Are they asking about prior experience? Is there an experience minimum? Are they then providing training on top of that? Is the agency performing the necessary background checks? And are they also following up on references of all candidates before hiring? Understanding and asking the question of how an agency vets their caregivers will give you a much better idea of just how seriously they're going to take it when they're taking care of your loved one. Number 5. How are caregivers matched with clients? You should be asking exactly how a caregiver would be matched with your loved one based on experience level, need, and as well as things like personality and availability. A good caregiver agency is never just going to put somebody random in on your case. There is careful thought and consideration as to which caregiver is selected to best suit the needs of your loved one. 6. How does the agency handle scheduling and replacements? If a caregiver calls out sick or there's an emergency and they can't make their shift, a good agency will always have options as to who to send to fill in the shift. Additionally, a good agency will always have their policy and procedure in place well ahead of time, so there's no scrambling at the last minute to try to fill a shift. Number 7. What is the cost of service? The most important questions. And an agency needs absolute transparency for this. They need to tell you exactly their hourly or daily rates, if there's any minimums involved, and what that looks like. If an agency is unwilling to give you exact numbers, that is a huge red flag. Additionally, you need to ask about their contract. Is it binding in any way, or is there flexibility? What does it look like for cancellation? Is there fees involved? A good agency will have no cancellation fees as well as a very short cancellation term. Ours personally is only 2 days. Healthcare is extremely fluid and you need flexibility in both your caregiver as well as the contract. If an agency cannot provide you with a flexible contract as well as straight answers to the cost, leave immediately. Number 8. How does an agency handle an emergency situation? Any reputable agency will be able to immediately disclose to you their policy and procedure. That is a fact. One of the defining factors of a good agency is how they handle their emergency situations. Number 9. How is the quality of care managed? How is an agency ensuring that good quality of care is being given? A good agency will call and follow up with clients on a weekly basis to make sure that everything is up to their liking. It is critical that in the first few days or weeks, you are seeing a lot of calls from your agency to make sure that everything is in order. Whether it's a new caregiver that comes in or an entirely new case, an agency absolutely needs to be following up to perform quality control and make sure that everything is up to the client's expectations and beyond. Additionally, the agency should be following up with any kind of family members that were involved in the plan of care. Everybody needs to be on the same page about the care that's happening, as well as the quality and what measures the agency is taking to make sure that it's only of the highest standard. Nobody should ever feel in the dark about their family member's care, and there needs to be clear and consistent communication always. Number 10. What are the agency's policies on family involvement? Has the agency reviewed HIPAA guidelines with you? Has the agency also made it clear as to who can be involved in the care of your loved one? There might be other family dynamics that are in play here, and an agency needs to be sensitive to that. They need to know exactly who they're dealing with, exactly who they can deal with, and who is answering questions, who is setting up cares of plan. The agency needs to take all this into consideration before they just start talking to any random stranger off the street. 11. What are the policies for termination of services? This is critical. If an agency has a long or binding contract, we've talked about this already, you need need to go on to a different agency. Flexibility is critical in this field. An agency should never have a binding contract that locks you into a term of service. You need to know these questions before you start services with an agency. A good agency will have between a couple days to maybe a week's worth of notice for termination of services with no strings attached. If they don't have that, not a good agency. Additionally, you need to find out about the money aspect of canceling services. If you're looking to cancel services, are you going to be refunded for any kind of money that was not used for care? A good agency will always refund every single penny that is not used for care. And I will repeat that again. You will get a 100% refund from a good agency on money that was not spent. 12. Does the agency offer any additional support services? A good agency should be like a healthcare concierge. They should be able to give you guidance and suggestions for not just home care, but for referrals within the entire scope of senior care. Whether you need social support programs, therapy, possibly you need somebody to help even move your loved one out of their home and into an assisted living facility. If you need transportation, the list goes on. A good home care agency will be able to give you quality and vetted referrals for all these kinds of services to make your life easier. Question number 13. Can your agency provide you with prior customer testimonials? This should be a no-brainer. Ask for a couple testimonials. Ask to talk to other people who've used your services that are willing to talk to you. You can ask your agency this, and they should be able to provide this for you. A good agency will never be shy about giving a prior testimonial or even allowing a new customer with permission to contact a prior customer in order for that new customer to receive excellent care for their loved ones. Remember, the best way to find out if this is a good agency or not is to hear it straight from the mouth of a person who's been in your shoes. Number 14, what are the caregiver's responsibilities and limitations? This could be its own video on itself, but you should ask about what a caregiver is and is not allowed to do. Very simply, the agency should know the regulations for both state and federal, as well as be able to give you a clear and concise answer to this. Caregivers are allowed to do a multitude of tasks, but they're also restricted on a multitude of tasks. Caregiver agency will know the differences, and if they don't, then how would they know to instruct the caregiver what not to do? Final question, what sets your agency apart? You need to ask this question. A good agency will be able to tell you exactly what sets them apart. They'll believe in the product because the product is quality. A less than reputable agency will have hesitation and won't really be able to answer that question because truly there isn't anything that sets them apart. Remember, if you ask an agency why you should trust them and they can't give you a straight answer, then you shouldn't.